Joining me now are three guests who have been on the front lines of this fentanyl crisis and, frankly, of the drug overdose crisis for some time. Former Chicago Mayor Lori Lightfoot, she's been a prosecutor as well before that. Dr. Andrew Kolodny, a medical director of the Opioid Policy Research Collaborative and president of Physicians for Responsible Opioid Prescribing. And Jan Rader, the former fire chief in Huntington, West Virginia, and director of the Huntington Mayor's Council of Public Health and Drug Control Policy. Welcome to all of you. I'm going to start with the former elected official here. You've been on the front lines, a prosecutor. You've just touched your own family with your brother. Where are we today versus where we were in the 90s?
Well, look, I think the good news coming out of Chicago is that we are really focused on harm reduction and treatment. We have decades of evidence, as you indicated earlier in the show, that the war on drugs was not a success. It didn't stop the problem. And at the local level, what we have to focus on is how do we help these folks? We get them to turn their lives around. And we've done a couple of things in Chicago. Number one is we made sure Narcan is available literally everywhere. I remember going into libraries and talking to librarians about their fear in certain areas of our city where addiction was very high about finding people in bathrooms that had OD'd. So we made sure we got Narcan out everywhere. Fentanyl's on test strips is critically important. And particularly because what we're seeing is not only a huge number of African-American males, 45 to 64, are the hardest hit population, but we're now starting to see younger people who had no interest in opioids, but were taking other drugs and finding that they also are now laced with fentanyl.
Laced with this.
Yes.
Jan, we first met 6 years ago when the issue was heroin.
Yes.
And this is, look, we're talking about an urban community in Chicago. We're talking about Huntington, West Virginia, a more rural community. Talk about the transition from what you were fighting with heroin addiction. I remember you were the ones going, I want to get these little Narcans in everybody's. I remember you talking about that.
Yes.
So now what is fentanyl like?
Well, it's worse. You know, 2017 was our worst year in Cabell County, West Virginia, a county of 92K. And that year we had 202 deaths from overdoses, and more than 70% of those were from fentanyl. And that was the year that fentanyl really came into our area. It's tougher, you know, gets tougher to save lives because that one time that they overdose can be it.
Is there any best practice you've seen or developed or tried to work with in the last 6 years that you think is worth pursuing?
I think that what we need to do is stay focused on each individual and be kind, and to realize that these are the most fragile people. It's very shame-based, it's guilt-based, and we need to provide them with the self-worth that they need to accept the treatment.
You feel like we need a cultural change?
I think we need a cultural change because still today the number one barrier is stigma.
More than anything else. Dr. Kolodny, look, you're part of this group for Physicians for Responsible Opioid, but that's been the problem, right? I mean, many doctors made us addicts.
Yeah, and you know, I heard earlier you asked the Ohio senators, why does Ohio have an especially severe problem?
Yeah.
I think one of the best answers to the question about why some geographic areas have been hit harder than others boils down to exactly what you're asking about, prescription opioids. We have good data that tells us that the opioid crisis is most severe in the regions of the country where opioids were prescribed most aggressively. Like
direct line. You believe there's a direct research line?
Oh, there's no question about it. And to really make sense of what's happening right now with fentanyl, it's important to understand that we, roughly speaking, have three groups of opioid-addicted Americans. We have an older, non-white group, mostly black men who became addicted to heroin many years ago and were longtime heroin users who are dying at a very high rate right now because of fentanyl in the heroin supply. And then we have the two groups of opioid-addicted Americans who became opioid-addicted post-1996. Their addiction began with prescription opioids. It's a younger group that switched from prescription opioids to heroin and is also dying at a very high rate from fentanyl right now. And then there's a middle-aged and older group of white Americans that became addicted to prescription opioids that are actually doing a little bit better right now since doctors have started to prescribe more cautiously.
So, Jan, trying to deal with this, look, in West Virginia, I believe they now have a drug-induced homicide law, right? That's called, that's labeled as first-degree murder. Is that the way out of this?
I don't think so. That's not, you know, to me, a strict law like that is going to stop somebody from calling 911 when somebody overdoses. So that makes that event more deadly.
What do you want from the Biden administration, or what would you have needed from any administration? Forget whether it's Biden or whoever, because this is I think, an above politics issue.
Look, every mayor is going to tell you that they need more resources. What we've seen that's been successful is the things that I talked about before, but we've also, I think, done a lot with diversion at the police stations. So our public health department, led by, I think, our gifted commissioner, Dr. Allison Arty, has worked directly with our police department. The people that we are diverting at the police station, 73% of them we don't see again.
Do you have enough? So you have police, right now I know every city is still trying to hire more police officers, just in general.
Yes. And
you have to have also police officers that know how to deal with overdose.
What we have done is we've stood up two types of teams. One that is got law enforcement involved, but really the social worker takes the lead for these particular calls. We've done a lot of training with our 911 call takers and dispatchers, but we have a separate team that's focused on opioid use abuse. That's the team that's going out there, that's responding, that's educating, that's working one-on-one, as Chief Rader said. But we've got to make sure that we use every tool in our toolkit, and its soft power is much more effective than the hard power of law enforcement for this particular problem.
Dr. Kolodny, I know the research is not fully there yet, trying to find, frankly, a drug that can help people not be addicted, right, in some form of this. Is that going to be our way out of this on the demand side?
Well, we do have good treatments for opioid addiction, and I think to bring down overdose deaths in the short run, if we saw that people had better access to the most effective treatments, and I'm talking about a medication called buprenorphine, methadone maintenance can also be helpful for many people who are opioid addicted. If opioid addicted individuals had better access to these...
Should that be over the counter?
No, it should not be over the counter, because these are also, even though they're very good treatments for addiction, they can be addictive.
But should every firehouse have this?
And every firehouse should have naloxone for reversing overdose deaths, but treating addiction should really be done within the healthcare system. And if someone who was opioid addicted could more easily access effective treatment than they could access fentanyl or heroin or prescription opioids, I really do think we'd see overdose deaths starting to come down.
And Jan, what about getting folks to ask for help? Is that still a barrier?
That's still tough. It's a barrier, and just like the mayor said, we have a team like that too. We have two teams. We have a team that goes out within 72 hours after you overdose and offers you treatment options. It's called a quick response team, and then we have a police officer paired with a mental health care provider to respond in the moment. But I think that we need to change our thinking and how we treat those that are suffering with substance use disorder, because they are very fragile individuals.
Addicts, this is a disease. This is not something that we should be shaming these people. We should be helping. Thank you for this.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.